Well, a warm welcome to this talk. It's Thursday, the 3rd of February. Just a few thoughts today, really, on the radically different approaches being taken by different countries. Now, let's start with a quiz. Which country has managed this pandemic best? What do you think? What would you answer? Which country has really acquitted itself best out of all let's say, the westernized wealthy countries? I think it's Denmark. I mean, of course, it's subjective. We can't say which is which, but Denmark's done extraordinarily well. So I want to look at that a bit this morning, because yesterday, as you probably know, they've abandoned all restrictions. Interesting, in the light of very high infection rates, of course. So this really is quite an interesting topic to discuss. Now, before we do that, I just want to look at New Zealand. So here's the situation in New Zealand. Now, they're going to have a gradual reopening of borders to its citizens, workers and international travellers, kind of in that order. And they're going to do it gradually and slowly. Thousands of New Zealanders are still stranded abroad. They can't get home, so that they're going to be able to get home pretty soon now, which of course is great news for them. And they're going to fully reopen the border to non-citizens in October. So here we see New Zealand taking a very moderate, tempered, longitudinal approach to this virus, while completely, utterly ignoring the nature of the virus. As soon as you get some community Omicron spread, especially if it's BA2 in New Zealand, it's not going to say, oh, well, we better wait for the government, because they don't want full reopening till October. It's just going to go through the country like a tsunami. I really don't understand the thinking of the New Zealand government here. You can only go with the biology of this virus. You can't have it suiting your political convenience. It's just doesn't make any sense to me at all. So what I would say, if you're in New Zealand, you're going to be exposed to Omicron really any time now, because the community transmission will take off really very quickly as soon as the restrictions are at least partially lifted. And the idea that you can do this progressively just takes no cognizance at all of the reality of the science of this virus, as far as I can see. But there you go. So that's New Zealand. Let's go on now and look at new data confirmed cases per million people. So let's look at these graphics first of all, because this really explains quite a bit. So now this first graphic here, cases in Denmark. Wow, they're high. Way high, look. Much higher than Australia, United States, United Kingdom, Canada. So let's just look at that. That's the green line going way off the scale for cases in Denmark. This is just an enlargement of that previous graphic, of course. Australia, United States, Canada, way below. Look at the cases in Denmark. They're actually off the scale. They're actually onto the next page, because they're actually way up there. So they're reopening despite these very high levels of cases in Denmark, which of course is fascinating. Now, if we look at one of the reasons I'm saying Denmark's done best, if we look at cumulative COVID-19 deaths per million, United States, United Kingdom, Canada, Denmark, way down at the bottom. Thankfully, Australia still very low as well, but of course they didn't get the infection till vaccination was reasonably ubiquitous in Australia. And again, I just want to blow this up, because this is the same scale. United States, United Kingdom in terms of cumulative deaths. Then we have this big to scale gap, Canada, and then Denmark. I mean, that is the difference in deaths between these countries. It really is quite an impressive performance from Denmark, really. So Denmark has put an end to all coronavirus-related laws. That's it. It's finished. Basically, Denmark is saying, right, pandemic's over. Off you go. Back to normal. As of yesterday, in fact. Basically, just back to normal. We're not worrying about this anymore. So they put an end to all coronavirus-related laws. Danish government: virus no longer deemed a critical threat to society. No longer a legal obligation to self-isolate if you test positive. BA2, of course, now dominates infections in Denmark. We don't have a recent percentage there. I'd be surprised if it's less than about 80% now, BA2. And of course, the rest is BA1, Omicron. So, Director of Infectious Preparedness, this is the National Institute Infectious Disease Agency, SSI, in Denmark. There was nothing for it but to let Omicron run through the population. I mean, just let that sink in. Here we've got the director saying, well, afraid there's nothing we can do about this. We just have to let Omicron run through the population because it can't be stopped. Can you see such a contrast in approach to New Zealand? New Zealand thinks they can taper it out. They can't. Omicron doesn't work that way. Denmark's saying, well, we're taking cognizance of how Omicron works and we've decided we can't stop it. There's nothing we can do about this, short of Chinese level restrictions, of course, which basically is not going to happen. It cannot be stopped. So that's the approach in Denmark. Let it run through the population. And of course, generating massive herd immunity as it goes. With Omicron, it's impossible to stop the spread of infection, even with severe restrictions. Impossible to stop the spread, according to the Danish authorities. Now, because of natural immunity and vaccinations, they're expecting the cases to go down by the middle of February. So that's in about 2 weeks. So what they're saying is basically we expect this to peak in a couple of weeks and then it will start going down. And of course, that'll leave. And all the evidences show it's starting to go this way now, as we've been predicting since we first discovered Omicron on this channel, that it's going to generate huge levels of immunity, natural immunity, and I'm assuming with pretty good longevity as well. So that's where they are. Let's go some more details. So down by the middle of February, as far as community health is concerned, COVID is now on par with a common cold. That's the position of the Denmark. A political science and government advisor. Throughout the pandemic, our data has shown that the key worry Danes is not their health, but overwhelming hospitals. Epidemiology in Denmark has not been politicised. And now this is actually from UK newspapers, but I think it is fair to say that Denmark has been the least politicised country. Now, other countries, this has been more politicised. For example, and I'll leave you to fill in the gaps there. The only thing that was really political, and we did argue about it at the time, was the mass culling of their mink, which I think was probably a mistake. But apart from that, it hasn't really been a political issue in Denmark. It's been science-driven. There's been consensus between the scientists, the government, and the people. Wouldn't that be nice? Wouldn't that be really nice? Where there is trust between those agencies and trust with the news agencies in Denmark. So 5 things that Denmark has done well, and I'll let you decide whether they've been done well in the country that you happen to live in at the moment. I'll let you decide that one. Yep, so there we go. It's actually pretty good from that point of view. Now, not been politicised, excellent. Social consensus and trust in Denmark's government has been hallmarks. If you have a strategy based on trust and solidarity, then you can actually open up with relatively broad agreement. They are taking the population with them. What aren't we getting in the rest of our countries? What's our governments, our scientists, mainstream media, all of these, what are they getting wrong that we're not establishing consensus? Because we're simply not. If you have a strategy based on trust and solidarity, where the vulnerable and the elderly are accepting the risks, taking on personal responsibility. Now, of course, this is what we're worried about. The main thing is that there are people that are still vulnerable to this. Although in Denmark, virtually all of them have been triply vaccinated, so less of a problem in Denmark. Allowing younger groups to live life as normal again. Young people, there's no question about it, lowest risk from this virus, paid the highest price. You know, when you've just started work in your early 20s or something, you need that income every week. I remember when I was a young staff nurse, you're just waiting for your pay every month, and you're living month to month. And if that's disrupted, young people have paid a high price for this. Okay, there's been furlough schemes and things, but very largely it's been younger people that have paid the price, and very largely it's been old people that have not died. Because remember, the average age of death in the UK from COVID-related illness is 82. So it's something to think about, this concept of intergenerational justice. Anyway, I stray onto sociology, which is not my field, I'm pleased to say. So what do I want? Want that one again. we're right, allowing younger age groups to live their lives as normal again. It's a trade-off based on data. So it's a trade-off, but it's based on data. This is the point. And they've achieved consensus. You could say that a lot of young people have been showing solidarity with the elderly through the pandemic, and now the elderly are showing some solidarity with the younger generations, as there's going to be presumably more guarding in Denmark to let the younger generations carry on life as normal. Danish Health Authority, I'm keeping my sights on seriously ill. So this is not a callous approach in Denmark. They're keeping the sights on the seriously ill. Looking at the figures of inpatients in intensive care, which, by the way, have just kept falling and falling and are now incredibly low, as are the intensive care figures in the United Kingdom. They've been going down. We have sky-high immunity throughout the population, partly due to our large vaccine acceptance, but also the widespread of Omicron. In other words, the authorities are saying here that the herd immunity that we have been long predicting on this channel in Denmark is kicking in now. It really is very good news for the end of the pandemic in Denmark. This also means that we will start to see the back end of this. Yeah, had enough of this pandemic. Let's move on. Epidemiologist, I think that this is the last sort of lockdown crazy pandemic wave, having gone through 2, 3, 4 pandemic waves, which is normal for recent historical pandemics. So there you go. This is normal for recent historical pandemics. I imagine COVID control will soon be similar to that of flu. So this is nothing particularly new. And it's disappointing. It's disappointing that certain epidemiologists and modelers in certain countries have not really appreciated that which is basic knowledge of epidemics, that we have these waves and then they become less severe and then it can become endemic, at least for a period of time. In Denmark, they seem to have realised this. And just before I forget about it, the other thing about Denmark, remember we talked to Professor Niels Høiby, one of the leading medical people in the world in this field. And he advises, he's the one that changed the recommendations for the Danish government to aspirate before they give injections, which of course in Denmark they've been doing. We have not. I'm afraid it's full marks to Denmark and 0 points to the UK and the US again. Quite a sobering comparison, this really. I just started thinking about this morning, but the more you think about it, the more sobering the comparison is, and the more self-examination we need, and the lack of humility there's been. So that's the main things there. Now, we did talk quite a bit about the problem with illness and death in the United States, which it's been quite appalling, that the death levels in the States, and we really do send our condolences to all the people watching that have been affected by it. And I know many of you have. It's been a major trauma, but of course, while we mourn the human loss, we also have to look for the scientific causes so we can put an end to this. And you've been writing in with some pretty interesting points that we already looked at the comorbidities, of course, from the science, but just a couple of emails about your experiences, because I think they really are illustrative of what's going on. Now, this is from a registered nurse. I haven't got permission to use her name at the moment, but one factor you might not fully appreciate from outside the States is how really poor our healthcare system, or lack thereof, in the United States is, apparently. We are well known for some fantastic, world-leading, of course, institutions, but only the very well-off and the well-insured are sure of good care. Many people have insufficient or no health insurance. Many of our hospitals are run like businesses, by cutting staff and costs with no consideration for quality of patient care. Well, not naming any names, but this seems to be something that's philosophically recognised in the United States. Many people with comorbidities don't get them controlled because they can't afford to visit the doctor or the test or the time off work or the actual medications. Now, I have had emails. I've done a series of lectures on diabetes, for example, about 20 of them, I think. And I've had emails from the States saying, people saying, I can't afford my doses of insulin, John. How do I manage my diabetes on lower doses of insulin than I can afford? And I've had emails like that from the United States. Again, if this doesn't give us pause for reflection of how we are treating human beings, maybe it should. Actually can't afford medications, dearie me. I'm sure you'll all agree that a COVID patient with controlled hypertension or diabetes will have better chances of a good outcome. Well, of course, we have to control comorbidities. A controlled comorbidity is basically largely accounted for. It's the level of control that's vital. Our unfortunate political priorities, I believe, created many bad outcomes, and that's a registered nurse with a Master of Arts degree as well. So, interesting reflection there. DMN has said this. My family knows lots of people who've died of COVID, a lot, at least 12 people, varying ages from 30 to 70s. People dying at 30, that really is tragic. And the one thing that they've all had in common was either obesity and high blood pressure. The US is incredibly unhealthy, particularly in the south and in poorer areas. It seems almost no one is mentioning this as not only a pandemic, but an epidemic of very, very bad health. So that's true. There is an epidemic of superimposed bad health in the States. So we've got superimposed pandemics, really. You can go into Walmart or Target, both big supermarkets in East Texas. I'm not exaggerating. As many as 75% of the people you see are obese, not thin, not normal, not overweight, actually obese. So that gives me personally some insights as to some of the additional reasons why the death rate in the United States is so much higher than other advanced countries. Now, that's all I wanted to say for this time, but I'm just going to give you a bit of something I've just started looking at, so it's not ready to present yet by any means, but a literature review and meta-analysis of the effects of lockdown on COVID-19 mortality from Johns Hopkins. And this really actually questions the scientific validity of some of the lockdowns that we've been through and their epidemiological lack of significance. So more on that next time. For now, but pause for reflection, though. We can learn so much by comparing one country with another. We compare Denmark's vaccination technique with Norway's vaccination technique, and we find that in Denmark, they have about 3 times less pericarditis as a vaccine complication because they're aspirating. We look at the way Denmark has now opened up despite very, very high cases. Everyone in Denmark is going to be exposed to this virus now in the next week or two, and then cases will start going down by mid-February. But because there is consensus and agreement between the scientists, the government, the media and the people, and indeed social media in Denmark, there is this concordance and agreement, and the country is moving together as a whole. And of course, the results speak for themselves. Lessons to be learned. Shall we leave it at that? Thank you for watching.